Welcome to Navicent Knows Health. I'm Cindy Busby, and I'm here today with Dr. Dustin Hoffman. He's an orthopedic surgeon here in Central Georgia, and today we're going to talk about his practice and treatment options for his patients. Dr. Hoffman, thanks so much for being with me.
Thank you.
Would you talk a little bit about a procedure that we talked about before, the anterior hip replacement, and tell our viewers a little bit about that?
Correct. So the anterior approach hip is one of the newer techniques of how we do a hip replacement. It's probably in the last 10 to 15 years, it's really kind of revolutionized the total hip replacement. And as opposed to going through the back or the posterior approach where we have to detach the tendons off the bone, we're able just to go through the front with a smaller incision. It's a quicker recovery is ultimately what it leads to. So patients that maybe have some posterior thigh pain or have to use a walker or cane or go to therapy, we're not able to do that with the anterior approach hips. So right now, especially in light of COVID, patients are really asking for this because people are a little afraid of going into a therapist's office or having to stay in the hospital for multiple days. So we can get them home, take care of their pain quickly, but then not have to expose them to the chance of contracting COVID.
Can you tell us a little bit about candidates for the anterior hip? Is there something that differentiates maybe one case from another, or does everyone seem to be generally able to have that?
So the way I train doing the anterior approach hip at Emory, every patient I do a hip replacement on is a candidate for anterior approach hip. So really in my expertise or my skill level, I pretty much do the anterior approach for anybody.
And you mentioned COVID. We all know how that has changed the way we have precautions in our offices and in hospitals. How has that affected the process for patients coming to see you?
It definitely makes us be a little more cautious with patients. So from the very beginning, patients are sitting in their car as opposed to sitting into a waiting room just to minimize the chance of being in a waiting room and contracting COVID from someone else. We're also screening patients before they come in the office for temperature. Obviously, anyone who's had exposure to COVID or who's been tested positive for COVID, we're not allowing them to come in. Then it even goes further to the post-op. Same thing, patients are staying in their cars before they come into the office. We're trying to use cell phone technology and telemedicine so that patients who don't have to come in person are able to still be seen. But obviously some patients have to be seen in an office, and we can't do that via telemedicine. So we're trying to make sure we're screening those patients very carefully.
Tell us a little bit about the 23-hour stay option for some of the procedures you do. Patients may think that they have a long hospital stay, a longer recovery. Tell us how you've condensed that to do it differently.
So it's all about kind of minimizing the risk and also tailoring every treatment option to every patient. Everyone's a little different. Some patients who maybe need to be watched closely the night of surgery. For those people, we have the option of keeping them overnight and making sure they go home the next morning. And for most people having an elected total hip or knee, that's all that we need. We don't generally need more than one night stay. So it's kind of a safety net for some of the patients who, even though they might not be able to go home the same day, they can stay and still get that high level of care.
When patients go home, you and I had spoken about this before, you have a very special way that you follow them. And how do you do that today in light of COVID?
In light of COVID, it's pretty much we still are using the same technologies. We're using the cell phone app to make sure that we have a close link with our patients. And if any problem comes up, we're able to kind of address that problem before it gets down the line and maybe people are having to go to the ER. So people are able to contact us quickly with our cell phone app. Additionally, for a lot of our routine care, that's all patients need. They need a phone call. So we can either do that now with a phone call or with telemedicine. So some of the same technologies we were using before COVID, we're just really implementing them a little bit more for some patients.
What would you say to a patient who might have been putting off a hip replacement, considering what has happened with COVID? How would you tell them to approach getting back and getting relief?
I think it's still the same kind of process before COVID as of now. It's debilitating pain that has failed all conservative measures, meaning people have tried medicines, they've tried therapy, and it gets to the point that their life is suffering. I don't think that now we need to keep delaying surgery because of COVID. We take all the precautions, we make sure they're medically stable, we make sure we screen them. But at that point, it's still important that that person gets seen and that we can offer them a treatment option. And because the patients aren't having to stay in the hospital for multiple days, I think we can get them in and out safely and also help take care of their pain.
Well, thank you so much for telling us about your practice.
Thank you very much.
And thank you for joining us at Navicent Knows Health. If you'd like to know more about Dr. Hoffman and his practice at Ortho Georgia, please visit us at navicenthealth.org.